So, good morning, dear students. So, we'll start with the next topic, that is gout. Sometimes gout is also called as gouty arthritis, and it is a type of arthritis where usually the patient will be having joint pain, there will be inflammation of the joints. So, gout is a type of arthritis, and in this condition, there will be excess uric acid in the bloodstream. So whenever there is excess of uric acid in the bloodstream, there will be formation of uric acid crystals. So this uric acid crystals will be usually deposited in the joints, especially of the greater toe. So this usually happens in gout. So remember that in gout there is excess uric acid. Because of that, there will be accumulation of uric acid crystals in the joints. Definition of gout or gouty arthritis. So gout is a type of arthritis which affects the joints or which affects the musculoskeletal system. There is one more definition which is a better one. So gout is a metabolic bone disease. Okay, it is a metabolic disorder where there is problem with the purine metabolism. So because of the problem in the purine metabolism, there will be excess accumulation of the uric acid. Okay, so all are already aware, uric acid usually is a excretory product, isn't it? So here uric acid will be accumulating in the body. So that uric acid will result in urate crystals in the joints and all. So that is why the patient will experience pain and other clinical manifestations. And here there is problem with purine metabolism. Purine is a type of protein that is present. So here, because of the altered protein metabolism, that is purine metabolism, usually the uric acid will start to accumulate in the body. So the normal physiology, normally we know that whether it is urea, creatinine, uric acid, all this is excreted through the urine, isn't it? It is filtered by the kidneys and it will be excreted in the urine. But here in this condition, what happens is, because of the abnormal protein metabolism or purine metabolism, more and more uric acid will be deposited, okay, or more and more excess uric acid will be collected, and that will result in urate crystals. Okay, so that crystals will be deposited in the joints, especially in the greater toe. Now particularly this urate crystals are referred as tophi. Okay, they are referred as tophi because they will usually result in lumps on the skin as well as in the joints. Okay, you can see here in the figure, that is a tophi. So tophi are uric acid crystals which are chalky deposits. So that is mainly happening in gout. And commonly gout condition is seen both in men and women. And commonly in women it is seen after the menopausal period. There are two types of gout, primary gout and secondary gout. Now primary gout is inherited. Inherited in the sense, usually it is got from the genetics, isn't it? So it is inherited, and mainly it is because of problem in the protein or purine metabolism. While secondary is acquired in the later stages of the life because of some other problems, we acquire secondary gout. Okay, so two types of gout is there. Inherited is mainly from family history or because of genetics, while secondary is acquired in the later period of life. Now, what is the reason for gout? What is the etiology or what are the causes of gout? As I have told, gout happens because of excess or overproduction of uric acid. Okay, so excess production of uric acid may be there, or this uric acid may not be excreted well from the body. Okay, so more production and less excretion of uric acid will result in gout. Next is hyperuricemia. Hyperuricemia means excess uric acid collection in the blood. There are some other risk factors for gout. Now already I told age, okay? Age, most of the time adults are more prone to get gout. Then gender, both men and women. Along with that, genetics or family history will play a major role. Lifestyle changes in the sense sedentary lifestyle or lack of physical exercise can cause gout. Exposure to radiation, okay, radiation therapy may result in gout, or exposure to any chemicals, toxins like lead, mercury, all this also can result in gout. Obesity is also one more major factor for gout. Along with that, medications. Now certain medications, if you are on certain medications, it may result in gout, like anti-tubercular drugs which is used for tuberculosis, levodopa, or if you are taking thiazide diuretics like hydrochlorothiazide or chlorothiazide. Then if you have got any recent trauma or injury or surgery is there, that time also there is a increased risk of gout. Along with that, if you have got any associated health conditions like psoriasis, leukemia, that is blood cancer, or if you have got any renal diseases where your body is not able to excrete the uric acid, all this will usually result in gout. Then sometimes severe dieting or starving or fasting can also result in gout. Then alcohol ingestion. When you take excess of alcohol in the diet, that itself can result in gout. Next is excess intake of proteins or purine in the diet. Now, if you take excess of shellfish, wine, beer, or animal meat, red meat, all this may result in gout. Pathophysiology or pathology of gout. So what happens is, due to the different etiological factors, already we have seen the etiology like excess intake of purines in the diet or because of any trauma, surgeries, all this will result in excess production of uric acid. So when there is more and more production of uric acid, what will happen? The uric acid will start to increase in the blood, in the kidney as well as in the synovial fluid, because you are not able to excrete the uric acid, but uric acid is going on depositing. Next, what happens is, when this uric acid concentration increases, obviously in the synovial fluid, this uric acid will form crystals. Okay, those crystals of uric acid is referred as tophi. Okay, so these crystals will start to deposit in the joints, in the connective tissue, and that is why you will get gouty arthritis, or you will start to develop the clinical manifestation of gouty arthritis or of gout. Similarly, what happens in the kidneys is, more and more deposition or excess accumulation of uric acid may result in uric acid crystals again. Okay, so these uric acid crystals may result in renal calculi or renal stones. Now next we will move on to clinical manifestations or signs and symptoms of gout. So normally we see that this gout commonly affects your greater toe. Here you can see in the figure. Okay, because of the tophi deposition, that is uric acid crystals are deposited, the greater toe or the bigger toe will be affected. That is called as podagra. The greater toe becomes red. There will be tenderness. Okay, that is when you're touching, you may have pain. And the person, commonly, first of all, it may affect your greater toe. Along with that, the other joints also may be affected, like your feet, ankles, knee, wrist, fingers and elbow. So wherever joints are there, all the joints may be affected. Along with that, it is also seen that gout is acute in onset. Suddenly it may start. So person may have fever, weakness of the body, malaise, the headache may be there, tachycardia also may be there, that is increase in heart rate. Patient will usually have severe or intense joint pain. Okay, so almost all the joints may be affected. Here also you can see here in the figure, okay, the greater toe is affected. Joint discomfort, redness will be there, limited range of motion. They may not be able to walk at sometimes. Pruritus or itching is also very common in the affected part. Other than that, you can also see that the tophi or the uric acid crystals may deposit in the tendon or even in the ear pinna. Okay, and here you can see in the figure, this is all tophi. Okay, they will increase in size and it also may result in ulceration. Next is nephropathy symptoms. I already told uric acid crystals may deposit in the kidney and it may result in renal calculi or renal stones. Nephritis, glomerulonephritis also may result. Okay, there can be inflammation of the nephrons as well. What are the complications of gout? Most of the time, person may have gouty syndrome. That is, gouty arthritis symptoms will be there. Tophi is also one complication. So your patient will be having uric acid crystals will be deposited in the joint, cartilage and soft tissue. Gouty nephropathy means gouty arthritis will affect your kidneys and may cause renal stone and renal failure. It may also cause cardiac problems like heart failure and hypertension, that is increase in the blood pressure. Diagnosis. Now, how we will diagnose gout? History can be collected regarding the type of diet they take or exposure to any chemicals or toxins or history of any family history is there of gout. Physical examination can be conducted to see the range of motion in the patient. Blood test can be performed, especially ESR, erythrocyte sedimentation rate. You will also see that there can be uh, the level of urea and creatinine also can be monitored. Then synovial fluid analysis. Okay, so you can see that there is a thick chalky joint fluid is there. X-rays can be done to check for swelling or degeneration, and even 24 hours urine specimen can be done. Next is medical management or drug therapy. For gout, usually we will give the drug xanthine oxidase inhibitors. Now, xanthine oxidase inhibitors, these drugs will reduce the uric acid production. Okay, they will reduce the uric acid production and therefore it will reduce the risk of gout. The drugs are allopurinol. Commonly we give allopurinol here. Next is non-steroidal anti-inflammatory drugs are given because patient is having joint pain, tenderness and all. So commonly we give ibuprofen, indomethacin as well as naproxen. Next common drug which we give for a person with gout is an anti-gout drug, that is colchicine. Okay, colchicine is anti-inflammatory. It will reduce the inflammation or swelling. The next drug we give is corticosteroids. We know the steroids usually reduce the inflammation or swelling in the joints. Example is dexamethasone and prednisone. Next is uricosuric drugs. Now uricosuric drugs, they will promote the excretion of uric acid. Okay, promoting it will help to excrete the excess of uric acid. So example is probenecid. Next is nursing management. Commonly we have to assess the patient's joints for any pain, range of motion and appearance of the joint for any tenderness or swelling. Excess of swelling is there or pain is there, you can provide with the ice pack application or even hot fomentations. Adequate bed rest is advised to the patient, and slowly you can start with joint immobilization. Start with anti-gout medication, give NSAIDs or analgesics to the patient, and increase the fluid intake. Okay, 2 to 3 liters of fluid is advised so that it will prevent the formation of stones. Next is ask the patient to avoid drinking alcohol, to quit smoking, and if they are obese, they have to reduce the weight. Okay, limiting coffee and tea is essential. Regular physical exercise and pain control. Next, most essential part is low purine diet. Tell the patient to take less of protein or purine in the food. That is, they have to reduce the intake of shellfish, liver, kidney, sweet beans, soft drinks, seafood, liver. Okay, all this high purine containing food has to be reduced by the patient.